Common symptoms of patients with nasal obstruction is the fact that they can't breathe through their nose. Some patients will be able to differentiate which side they can't breathe through, and that might tell us there's a structural abnormality. In other patients, they might have a lot of congestion, such that they've got a lot of phlegm coming at the front of their nose. We term that as rhinorrhea. Patients usually say they're having to blow their nose very often or use lots of tissues. Some people actually get the phlegm going to the back of their throat. We call that post-nasal drip, and a lot of patients will have throat clearing as a result of that. They might be coughing or expectorating the phlegm. Very rarely, some patients might get some bleeding coming from their nose, and that can be due to a misuse of lots of over-the-counter medication that might lead to the lining of the nose becoming very thin as well. So in short, it'll be a combination of either having a structural problem or a physiological problem. So patients will usually say, I can't breathe through my nose, right? And that might actually be due to a structural problem in their nose. So somebody might have damaged their nose and had a fall, or the nasal bones are deviated to one side, or the septum's deviated. So if they've not had an acute trauma, which has caused a nasal deviation, a lot of us have a deviated nasal septum. Things that can contribute to that are how the nose actually functions itself, and those are physiological causes. So a lot of people get stuffiness inside their nose. So the actual lining of the nose becomes very boggy and edematous with mucus and phlegm, and that then contributes to a problem. It's not uncommon to have both problems of having like a septal deviation and then a nasal congestion on top of that. That makes people feel very, very blocked up. So the first point is actually doing the flexible nasal endoscope, which actually gives us the clinical diagnosis of how to treat this patient. So that's actually passing a very small nasal endoscope into their nose, and we're going to have a look on both sides to assess their nasal cavity. So in doing that, you're looking at the nasal septum, the small bones inside the nose. You're looking at the lining of the nose to see if there's any congestion. And you're also looking at the sinus openings. You're looking at what we call the postnasal space. And after that, the next step would be a CT scan of the patient's nose and sinuses. So the treatment options for somebody with a nasal obstruction depend on the final diagnosis, whether the patient has responded to conservative treatment and the need for surgery. So effectively, with people with nasal obstruction, if it's due to something like a structural abnormality like a deviated septum, we might trial them on nasal steroids, and it's the same with patients with rhinitis. If the patients normally respond, we will see and put them on a medication for long term. If there is a structural abnormality, it might require an operation, and we've discussed that with the patient. This is also dependent on the CT sinus findings as well, on the need for any operation.